Okay, I think we're ready to begin. Thank you all for joining us today in our ongoing series having to do with employers and the pandemic. This must be the 10th or 15th webinar we've had. We began in February of 2020, and we have come a long way. And today we will be discussing how employers can solve the challenges posed by the new OSHA vaccination mandate. So we have a great presentation lined up for all of you. And as is usual, we'll try and limit the formal comments to about a half an hour from our guests, and then we'll have plenty of time for Q&A. All you need to do is hit the Q&A button, type it in at any time during this webinar, and I will direct the questions to our panelists. And if anybody wants to ask me a question, as usual, you can always go ahead and do that. So the newly announced OSHA ETS, and so for everybody who doesn't know what all of these abbreviations mean, ETS stands for the Emergency Temporary Standard mandate. And one of the things that you'll hear our legal advisor today talk about is and specifically how to disabuse all of us of the nomenclature from temporary, and that this is much more likely to be something that's not temporary, and she'll get into that. But this is about enforcing the COVID-19 vaccination policy and what the challenges are for employers who really need to meet these regulations with urgency, as you'll hear, within 30 days for some, for 60 days for other of the requirements, and accuracy while managing this this problem and dealing with some of the very complicated issues of vaccine hesitancy and other problems relating to get a workforce all in compliance. So there's a new set of questions and decisions. We've come a long way in the last 22 months, and hopefully we will soon be seeing this pandemic in the rearview mirror. And I think that this vaccination mandate will probably be very influential in getting us there. So we have expert panelists today. We're going to address these topics, which hopefully you'll find relevant. The first presenter is going to be Valerie Bluth, who is a partner in the Labor and Employment Group at Elinoff, Grossman and Scholl. She is a member of the Labor and Employment Practice Group there in New York City, and she has a wide-ranging practice which involves guiding businesses on employment-related issues from employee onboarding through post-termination disputes. Since the beginning of the pandemic, she has been her firm's point person for providing COVID-related guidance to clients across multiple industries in multiple states, and has worked tirelessly to untangle the web of requirements and recommendations for running a business during the pandemic. So for the purpose of full transparency, I want everybody to know that, in fact, EHE Health has retained Valerie and her firm on and off over the past 20 months for these purposes, but should also understand that in no way does this presentation represent legal advice on the part of Valerie. It's purely informational. She's always available. Her contact information is at the end of the deck, but in no way is this meant to be formal legal advice nor further obligation. So we wanted to just have that disclaimer there. And many of you already know our chief client officer, Greg Mansur, who has been a deep and expert in the benefit consulting arena for many, many years, being a senior partner at multiple large national organizations, and further has been leading the charge on deploying our Safe at Work platform for the past 20 months through our large self-insured client base. So with that, I'm going to pass the microphone to Valerie. Welcome and thank you. Well, actually, sorry. my Q&A panel is obscuring the agenda. So I think I went over this a little bit in the intro, but what the agenda really is here is to explain the ETS, to go over some of the testing policy and the vaccine status and masking issues. And then Greg will talk about what employers should be doing to prepare, and he'll be talking about some due dates and a lot of the processes about vaccine verifications and the like. So I apologize for that. Here we go, Valerie.
Great. Thanks, David, for that introduction, and welcome everyone. So this is a brand new emergency temporary standards that was issued by OSHA at the direction of President Biden that applies only to employers with more than 100 employees. And as David noted, the nomenclature isn't great here. OSHA issues these emergency temporary standards at various times for various reasons, but even though it might say temporary and the guidance that's available says that OSHA anticipates that this will be effective for the next 6 months or so, they will be reevaluating at the end of or towards the end of the 6-month period and can extend this ETS sort of indefinitely. It could be on a monthly, tri-monthly, 6-monthly basis, whatever it might be. You should expect that this is not going anywhere. Until there's no grave danger of COVID, this is going to be in place, I think is really the takeaway here. So you got to know what it's about and you got to get prepared to take action. So what is it? With limited exceptions, the ETS that's applicable to private employers with 100 or more employees, which I'm going to call the 100 plus ETS for shorthand, requires that employees have to either be fully vaccinated against COVID-19 to come into the workplace or otherwise provide a negative COVID-19 test on at least a weekly basis. This ETS is currently in effect. It is subject to some legal challenges, but I think it's very likely to be upheld, in particular because this is not just you have to get vaccinated. This is if you're not, you have to get tested. So really, there's not much of a burden. Either you get vaccinated or you show us that you are negative, that you have a negative COVID test, and you can work. And if not, you can't. It applies to all private employers with 100 or more employees, with some limited exceptions I'll go over in a second. But how do you count these employees? It's all of your employees across all of your US workplaces. It does not include employees of staffing agencies or contractors that are working at your workplace, but it does include your remote employees. So if they are your employee, they are counted as part of this 100 plus count. And you count the number as of November 5th. And if you were already over 100 as of November 5th, this ETS applies to you as long as the ETS is in effect. That includes even if you go under 100 employees. It's like once you're covered, it's a trigger and it's forever until there's no more ETS. If you were under 100 employees as of November 5th, but you go over that 100 limit, again, even if you then dip below, you are now covered for the duration of the ETS. This doesn't apply to healthcare settings, which is subject to a different ETS, the OSHA healthcare ETS. It does not apply to employees who work exclusively remotely or exclusively outdoors, meaning that if they are coming to your workplace and they're only working outdoors, they never come inside other than for a limited purpose, like to use the restroom. They're not subject to these requirements, but they do count as part of your 100 employees. Same thing with remote. Again, independent contractors doesn't apply. You can make them, but you're not required to. What do you have to do? You have to develop, implement, and enforce a policy that either requires mandatory vaccination or allows employees to either get vaccinated or to undergo weekly COVID testing. And if you're unvaccinated, wear a face covering at the workplace. Sample policies are available on the OSHA website. There's some links to those resources at the end of the presentation. You can feel free to use the OSHA sample policy, or you can work with legal counsel to create a policy that works for your specific workplace. And if that's something that I can help you with, feel free to reach out after the presentation. I will say that this preempts any state or local requirement that bans or limits an employer from requiring vaccination, face covering, or testing. So that means if you are you have employees in Texas and Texas says employers can't require face coverings and they can't require vaccination, this ETS is making that moot. You are now required, if you are otherwise covered, to follow this regardless of what the state might say. It does not preempt generally applicable requirements that are supposed to protect the public health in public places, including those that are applicable to both employees and the public. So if you're in New York City, you're probably familiar with the Key to NYC program, which requires that in order to enter a public setting such as a store, event venue, restaurants, gyms, and certain other venues, you have to have at least one vaccination dose. And here, that's not going to go away. They're going to say, yes, this is still in place. This might add to it though, and say, okay, you can't just have one dose. If you are an employee, you have to be fully vaccinated. Individuals, public individuals can still go in if there's only one dose. So there's not full preemption there. The other thing you have to do beyond the policy is determine the vaccination status of every employee by obtaining proof of vaccination. So that is actually counter to some other requirements around the states and cities that have been in effect during COVID, which is, we don't want your proof. We're not going to keep it. We're just going to mark off that you actually showed it to us. Now you actually have to keep a copy. And what's proof? CDC card, medical records documenting vaccination, like a summary of after visit summary that shows that you were there to get the COVID vaccination, or a record of immunization from a healthcare provider or pharmacy. There is also a prospect for attestation, but that's very misleading. I know the New York Times came out and said, you can attest to your vaccination status. Only if you don't have any other means of getting acceptable proof of vaccination and you've tried, and you will attest to the fact that you've tried everything to get a copy of your proof of vaccination. And you have to include what vaccine you got, when you got it, where you got it. And you have to affirm, essentially under penalties of perjury and criminal, acknowledging that you will be subject to criminal penalty if you lie. So I would not count on anyone being allowed to attest, except in very, 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 very limited circumstances. You also have to maintain, as I mentioned, a record of the vaccination status, preserve proof in a confidential medical file, whether that's the employee's individual file or a confidential file that has all vaccination proof. That's up to the business. You also have to create a roster that clearly indicates vaccination status, fully, partially, not because of a medical or religious accommodation, or not at all, or otherwise haven't provided proof. You also have to provide up to 4 hours of paid time off to each employee to receive each vaccination dose, and reasonable paid sick leave, which is categorized up to 2 days to recover from any side effects experienced following each vaccination dose. In terms of sick leave, if you already have a sick leave policy, you can charge the sick leave to the employee's sick time bank. But if the employee does not have any sick time left, or you don't otherwise offer sick time, you have to provide up to 2 days. So beginning January 4th, 2022, employees who are not fully vaccinated must be tested for COVID-19 at least weekly. Everything else that we've just talked about, the determining proof of vaccination and implementing the policy, that all has to be done by December 6th. But the keeping employees out of the workplace unless they are vaccinated or otherwise test negative weekly, that doesn't go into play until January 4th, 2022. If you're going to have employees taking COVID tests, you must maintain a confidential record of each test result, much like you would with the vaccination proof. You don't have to pay for the cost of testing under the OSHA standard, but I really want to stress that the OSHA standard does note other laws and regulations might require employers to bear the cost of testing and or pay for time spent getting tested. The Fair Labor Standards Act and state or local labor laws, including the New York labor law, those are the kinds of laws and regulations they're talking about. There is a requirement to pay for the cost of required testing and time spent getting the required tests done. And that includes, if it's outside of work hours, from the time the person leaves their apartment or their house to go get the test until the time they either go to work or return home from that test. So please don't just think that OSHA says we don't have to pay means you don't have to pay. It's very likely that you do. Consult with counsel is my recommendation. If you're not fully vaccinated, you have to wear a face covering indoors, which already does apply even before January 4th, or when occupying a vehicle with another person for work purposes, even if that other person is vaccinated. You also have to provide information about vaccination and the ETS to all your employees. This is an affirmative requirement. The CDC has a bunch of resources out there, including this key things to know about COVID-19 vaccines. OSHA has said providing a printout of that CDC publication is sufficient in terms of providing information about vaccine efficacy. You have to notify them about protections against retaliation and discrimination for reporting work-related injuries or illnesses, filing an OSHA complaint, otherwise exercising their rights under this 100+ ETS. OSHA put resources up on their website. The link is at the end of the presentation. Just use what they've got. Don't drive yourself crazy, but just know that you have to do it, and make sure that the information is in a language and at a literacy level that the employee understands. So depending on your workforce, you might need to take some of what OSHA or the government otherwise puts out and have it translated if they haven't already, or otherwise, if necessary, I don't want to say dumb it down, but dumb it down if the workforce is not actually going to get what you're trying to tell them. And with that, I'm going to turn this back over to David and to Greg to talk about a little bit further about what employers should do right now.
Thanks so much, Valerie. Greg, you're up.
All right. Thank you, David, and thanks for that nice overview, Valerie. So what we thought we'd do here is really just talk through, based on what Valerie described, how to break down some of the action plan for employers in light of the 30-day and 60-day rollout expectations that were promulgated in the standard. So, as you heard from Valerie, really the first wave of effort is focused around the vaccination question. And in that respect, what employers really need to be working on is having, a documented policy around vaccination, what their requirements are. We're working with companies who are, either fully vaccinated or intend to have their workforce fully vaccinated. We have others we're working with where it's a bit of a hybrid policy. If you're coming into the work site, you have to be vaccinated. Otherwise, you can be unvaccinated. And then some are, having a more optional approach, vaccinated or going through testing. But you need to really document what those policies are and have those ready, come December 6th. And then it's really important to start collecting that vaccine status. The thing I think that's important for an employer to think about here, what you want to do, at least with respect to December 6th, is understand who's vaccinated and who isn't. And then that extra 30 days going into January is the opportunity for the unvaccinated group, based on their understanding of what the policies of the employer are going to be, to really decide for themselves, is it, do I want to get myself vaccinated, and give time for them to act on it. And the employer really needs to think about having a process to get that first wave of vaccination information going, but also to be preparing for the ongoing intake around folks who go from an unvaccinated state to a vaccinated state. She talked also about some of the vaccine notices and other things that you need to do. I think what was really interesting here in the standard is it's obviously finding a way to encourage people to get themselves vaccinated. And, the nature here of the ask from OSHA is really along those lines, helping your people understand benefits of vaccination, supporting them in that, answering questions, and giving them the time off to get themselves vaccinated. So really, trying to work along those lines, I think, is an important thing. For those that are, going with a model that will involve some testing, you really need to think about what your strategy is for testing now. I'm going to talk a little bit more about how to think about testing in a couple slides. But what you probably all are seeing and hearing is there are different types of testing approaches. There are some strains on the supply chain right now around testing. And as we're working with clients, we're really encouraging them to think ahead about the population that is unvaccinated, that may need to go through a testing routine, and to start making some plans around that. So this is the time to be doing that. That's not necessarily formally required in the standard. I just think that's a good practice for employers to be thinking about. The other thing I think that's really important to note, Valerie articulated this as she was giving an overview of the requirements, there are quite a number of record keeping requirements in the standard. And it's really important to make sure you as the employer have that process worked out. As I've been working with companies, over the course of the pandemic, there's been all varieties of things. Some are using their HRIS system to help with some of this. Some are using a third-party system. Some are just doing it on internal spreadsheets or tools like that. There are record-keeping requirements, and you are expected in your compliance with the standard to be able to produce that information upon request in a timely fashion. So really thinking through, what your process is, and particularly when you think about folks that are in a vaccinated track versus an unvaccinated track that's requiring testing, and how that will change over time, having a good system strategy around that. This is the time to be thinking about that. Now, as you get into getting ready for January 4, it really does get to be more focused about, okay, what is the testing plan? What's the execution strategy around that? And so that's not just ordering tests and supplies. That's obviously something you need to do, but the testing strategy, if you have a population or a set of populations doing that and you're a national company, you need to think about how to train your workforce leaders and all of those change management aspects here to help them understand what the expectations are. And if they're being asked to help with some of the oversight of a testing program, giving the different types of tests. Like I said, I'll talk about some of that in a moment here. And then certainly communicating to your workforce about what the expectations of them are as they get into a testing track, as well as just continuing to promote vaccine. Those are the really key things employers need to be thinking about over these next 30 to 60 days. And so what I thought I'd do is maybe just kind of highlight in the next slide, an approach around the vaccine verification process. We've been doing this for ourselves. We've been helping clients with this process, but it really breaks down into a few key steps here. You need to communicate to your people what to do. It's a question, are you vaccinated? If you're not, and then it's collecting the right information around that process. Getting them through that process in a structured way is key. I've seen some organizations that have been tracking vaccination, but they've really been tracking it on an attestation model. And as Valerie articulated, that's not sufficient to be in compliance with the standard. You're going to need to go back. If you've only done it based on their word, you're going to need to go back and have a mechanism to collect the appropriate type of documentation and evidence around vaccination. There's a variety of things that are articulated. It's getting copies of their CDC card. It's getting copies of the card or the digital record if they went to a pharmacy or a provider. We have the ability to ping public health registries. Some public health registries are providing digital evidence of vaccination too. All of those are, accepted sources of documentation. But having not just the status, but also the documentation, the information that supports the vaccination status is a key thing. And then, as I mentioned, before, really having that management system in place to track the results, understand, who's vaccinated, who isn't, partially vaccinated, all of those different types of things are really a key need as you look ahead. So why don't we go to the next slide, David, and talk a little bit about the testing process. As we get into this one, I think going into the standard before it was released, there were certainly some surprises there that came out of the standard, probably the biggest one being, the proctoring requirement around rapid tests. A lot of employers, as they were anticipating the standard coming forward, were not really prepared for that. And we're hoping that that could be avoided. And that obviously adds a lot of logistics into the mix. But just like we have to do with the vaccine tracking piece, we need to think about folks that are going through a testing track, making sure they understand what is expected of them, what that frequency is. Are you going to do a testing Tuesday? How are you deploying the testing? All of those different types of things. And certainly with companies that have large workforces, in different types of settings and contexts, you need to think through where you're going to perform the testing, and then, the manner in which that testing result is going to be produced and come through into the system. What the standard allows for is for the employer to be performing the testing and collecting that information, but it also, allows for the individual to get themselves tested and to provide proof of testing. So having the ability to kind of work with those different models is really going to be key. When it comes to this, verification of the test result, the key thing that the standard really articulated is that the test, if it's a self-administered test, it cannot be read and interpreted by that individual. There needs to be some independent aspect to the interpretation of the result. That could be going through a lab, or it could be done through proctoring or some type of telehealth professional doing that. And certainly if they go to a provider, having a record of a test being performed at a provider would suffice. But there's a lot of different applications here around testing. And this is certainly where I think a lot of employers, this is why it's really important to start thinking about your testing strategy now if you can't implement a full vaccine mandate on your population. And the testing is not just a positive or negative type of information. You want to make sure you're collecting the right information and able to document it in the system, collecting that in a structured way so that you can be in compliance with that and address anyone who might come back and say, okay, employer, you've been testing me for the last week, so I'd like to get a report of what my testing summary is. So that's the way we're thinking about working with organizations around the testing process, and trying to pay attention to some of those situations that exist out there based on different circumstances for the workforce. The last thing I just wanted to talk through, we're showing a visual here, but everyone's approaching these in different ways, is really making sure you've got that approach around a platform that integrates these two kind of critical pieces of information about your workforce, those that are vaccinated and those that are unvaccinated. And if unvaccinated, what are their testing results, those types of things. Having that integration and that ability to really see that information across your organization entirely, as well as at that local and site level, is really key. And, as I mentioned, getting ready for the standard to go live is one thing, but people are going to move. Hopefully, we'll see good movement on this front, but people that are in an unvaccinated status over time will move into a vaccinated state. And that changes whether or not they're subject to testing. So having that integration, that kind of capability in your testing and information, or your vaccine and testing information platform, I think is a really key need for an employer to be paying attention to here. And there's different ways to do that. Obviously, there's third-party solutions. There's a way to do that internally, but it's important to be thinking about all of those aspects and the level of detail you need to get to be in compliance with the standard. So I think with that, David.
That's great. I'm going to move to, this is the contact info, but we have some questions coming in. I'll try and summarize a couple of them to make them into one. And as we discussed actually before this webcast, Valerie, for you, the question relates to determining the size of your employee population that makes you eligible to be compliant versus how many people actually need to be vaccinated. Those are two separate measures, correct? If you could walk through that.
Yeah, so you need to count every employee, whether they work remotely or whether they're on your premises and across the US. So there is some exceptions for a franchise context in which the franchisor and the franchisee could be considered separate and not joint employers for the purpose of aggregating the employees. But it's only if the franchise is independently owned and operated, in which case then you wouldn't have to count all of the franchise employees along with the franchisor. That's a limited circumstance. But in terms of who actually needs to be vaccinated and who actually or otherwise get tested, that's only people that are physically coming, employees, not contractors, unless you want them to be employees of yours that are physically coming onto your work site, whether that be in your office, at a store, at a restaurant, or otherwise. If they're exclusively outdoors, for example, if you are a construction company or landscape architecture company and your employees only work outside, they would not have to be vaccinated or otherwise get tested. But if they're going to be around other employees and come inside, let's say into a trailer or into an office, then they're going to not be exclusively working outside, and they would need to be vaccinated. So I think that this exclusively outdoors option for exemption is not really going to be all that common.
So to be clear, if you had 500 employees and 100 and 450 of them worked outside, you would still have to comply, but you'd have to comply for the 50 who worked inside.
Yes, the 50 would be subject to the mandatory vaccination and or testing.
And you don't fall under the 100 threshold because in total you have 500.
Correct.
Okay, that's great. By the way, I'm getting questions on both the chat line as well as the as well as on the Q&A. So don't restrict yourself. So people can use both of them. I have a question, another question. This is for Greg. We'll start out. This is the issue of cost, vaccination versus testing. We have discussed this internally. Certain industries, because of considerations and anxieties about losing employees, are moving more towards a testing environment, which is far more expensive, I would probably think, than a vaccination environment. I mean, can you give a perspective on who's doing what and what other sectors, how the different sectors are kind of behaving with respect to their emphasis on vaccination versus testing, or a combination?
Yeah, I've seen, it's a good question. You know, a lot of the companies that have some blue collar workforce segments have, you know, generally been a little bit more cautious about going down a complete vaccine mandate. So we've seen them really try to explore, you know, different mechanisms there. In some other populations, some other white collar, some professional services, we've seen them go more toward a hard vaccine mandate. If it's not a full mandate across the workforce, it is, you know, one that is restricting people that come into the office, for example. You are obviously seeing, you know, the employers that have federal contracting standards to be in compliance with have to really be in compliance with that standard, and so don't have as much flexibility. But those that are really in that OSHA mandate are kind of all over the map. And the other question, I don't know if it's come in yet, that we're getting is, you know, are employers going to pay for the testing, or will they, you know, require the employee to be on the hook? And on that front too, I think, you know, employers, their preference is to avoid that cost and put the burden onto the employee. Some aren't necessarily, however, going to do that coming out of the gate come January 6th. They might implement that over time just to give people a little extra time to get themselves vaccinated and through that, but they may choose at some point, you know, after January 6th to make the burden of testing and the cost of it fall on the employee.
Yeah, and just to follow up on that, I just want to make sure that it's clear that the employer doesn't have to provide the test. They can require that employees go get tested elsewhere. But under the FLSA, the Fair Labor Standards Act, because it's a required test, even though the government is saying you employer have to require it, it would be a risky move to require the employee to pay for out-of-pocket testing costs. So I would suggest getting a roster of places that employees can go, particularly near the work site, that they can get a test for free. Certainly in New York City, any New York City Health and Hospitals Corporation location or City MD location, it's free testing, and you don't need insurance. So that would be my recommendation if you, the employer, are not going to be providing the testing. And there was a question in the chat, actually, I just saw, speaking about testing, about whether the telehealth can be AI through an app, or it doesn't need to be a live person. It needs to be a live person in the sense that the reason that there's telehealth as a requirement is because someone has to watch the individual take the test, swab their own nose, and also review the, you know, the process of putting the swab into the testing tray or whatever it's called, and also then reading the result or seeing the results so they can report on it. There's a certain tests that you can order that are designed to be used via telehealth. And then there's others that are designed to be self-administered and self-read. If you're going to do the administered and self-administered self-read, it needs to be done at the work site, like Greg noted, with the employer watching the employee swab their own nose, put it in the tray, and look at the result. And then the employer's gonna have to figure out, how do we keep a copy of that test result? Because you're not gonna keep people's testing trays with swabs put in there. My recommendation would be a timestamped photo, that you then put the photo with the employee's name, into, let's say, a PDF or some other electronic form and keep that as the record.
Great. By the way, the question came in on the chat. Yes, we will be distributing the PDF of this presentation afterwards, so don't worry about that. So the next question, I guess this would be for Valerie. Any guidance on what to put for termination reasons when somebody doesn't want to comply, voluntary or voluntary or involuntary? Is it a policy violation? How does that work?
So as a general matter, states are not going to give people unemployment, whether they abandoned their job or resigned because they refused to comply with the COVID mandate, or the employer said, well, then you can't work here because you refused to comply. So I think the distinction is probably not one of great importance. You can put in your policy that employees that don't comply with the testing and or vaccination requirement will be, deemed to resign from their position. You can also say, will, be terminated for cause or for misconduct, gross misconduct. I don't know that I would consider it just a policy violation, because we don't want to get into a situation where they apply for unemployment, they ask for your record, all it says is policy violation, and then they can't substantiate that's the reason. So if you're going to use a policy violation as the rule or as the reason, I would suggest detailing it a little bit more so that it's clear that the employee was subject to a mandatory vaccination or test option and refused to comply.
Okay, I'll go to the question panel now. Do you have to give employees time off to get tested weekly?
You don't need to give them time off. You could, but if you're having people get tested and they don't have time off to get tested that you're paying for, you're otherwise going to need to pay for the time spent getting tested while off duty if they're a non-exempt employee. If they're exempt from overtime and they have the right salary and duties to meet the test for exemption, you don't have to give them extra paid time off. But for non-exempt employees that are paid generally hourly or that are otherwise entitled to overtime, you are going to have them report that as work time and give them pay for it. I wouldn't necessarily call it overtime or leading to overtime, because it's not actually time, quote unquote, worked, but it is compensable time under the Fair Labor Standards Act.
Okay, can you expand on the differences between the federal government contract mandate versus the OSHA ETS?
Sure. So if you are a federal contractor, meaning that you have employees working on federal contracts, it's not just federal grant money, it's actual federal contracts. There is no option after January 4th. They actually just recently amended the date so that it coordinates with this ETS. There is no option for testing out in order to come to work on a federal building on a federal contract site or doing federal contract work, versus the OSHA 100 plus ETS, which does allow for a test out option. And if you have employees, if you are a federal contractor, but not all of your employees work on federal contracts, I have some clients that have some federal contract employees and some not. Only the federal contract employees have to comply with the federal mandate, that safer at work mandate regarding vaccination only, no test out option. The others would be subject to, if you want to, whether you're a federal contractor or otherwise, put in a mandatory vaccination policy. You do not have to allow testing, but you either have to do vaccination or testing. You can't just say, I'm going to do neither. So that's really the interaction, is if you're working on a federal contract, no test out option. If you are otherwise working for a covered employer and you are not vaccinated, you have to get tested.
Okay, next question on the question panel is about boosters. How do they relate to this?
So the current definition.
I mean the third boost. I presume the questioner is the third shot. Yeah.
Yeah. So the definition of fully vaccinated under federal guidance is still 2 weeks after your second shot of a 2-dose vaccine series or the initial shot of a 1-dose vaccine series. So 2 weeks after Pfizer or Moderna's second shot, 2 weeks after your J&J first shot, you are considered fully vaccinated. The government has not put boosters into the definition yet. So even people that it's been more than 6 or 8 months since their quote unquote full vaccination, they are still considered fully vaccinated for the purposes of this ETS. You do not have to include boosters in that definition yet. this is all of this information we're giving you is disclaimed and caveat is this is current as of today. This could all change tomorrow. The Department of Labor could come out and say, oh, you don't have to pay for the time spent getting tested either if they don't want to get vaccinated. We don't know what's going to happen. But for right now, these are the rules.
Okay. The next question is, do banks fall under the federal contractor mandate?
It's going to be a fact-specific answer. I don't know that there's a categorical banks are not included. I don't think that that's the case.
So it would, I didn't hear.
If you're a bank, you should fall under this standard. I don't believe, unless there is a specific federal contract that the bank is working under. So it's a fact-specific inquiry. I can't just answer on a blanket statement.
Okay, so for maybe for that person who asked that question, if there was a more specific fact-based, fact issue around exactly what they're doing for the federal government, that would, you'd be able to clarify that, right?
Yes.
Okay.
I need to look into it a little bit further, but I can definitely assist.
Okay. What are the next on the question thing? What are the testing obligations? Sorry, if a test turns positive, what is the obligation of the employer thereafter with a positive, a COVID positive person? It could be Greg or Valerie.
The key obligation is to get that person off of the site if they're at the work site.
Yeah.
If they're testing remotely, you'd want to make sure that they are not coming into the work site. That there and Valerie, you can speak to this. There really aren't any hard contact tracing types of obligations or anything like that that are delineated in the standard.
Correct. The only requirement is that people be excluded from the workplace and that they follow the necessary isolation and quarantine procedures. Right now, around the country, I don't think this is not the case anywhere, that once you have tested positive, you must quarantine for 10 days from the date you took the positive test if you are asymptomatic, or 10 days from the date that you became symptomatic if you became symptomatic subsequent to taking the positive test. If you're symptomatic and the 10 days are up and you have not had your symptoms improve and you have not been fever-free without fever-reducing medication for at least 24 hours, you cannot come out of quarantine until those things are both correct. Once you take a negative a test that turns out positive, especially if it's not an employer administered test, the government is likely going to contact you as an individual, and the business, depending on what state you're in, might have obligations to notify the health department that there is a positive test in your organization. If it's not someone who was ever on site or hasn't been on site in the last 10 days, I wouldn't be quite so concerned about it. But if someone was on your premises, the employer should generally contact the local health department, and there might be some contact tracing that the health department does.
So do they need a doctor's note to come back?
No, please do not require a negative test to come back. It's only going to end with you having to keep people out of work longer. People can continue to test positive for COVID for up to 3 months after they've recovered. So if you require a negative test after a positive test, you're not going to get it. The standard, I actually would need to take a closer look about if you've recovered from COVID. I think if you've recovered from COVID, you like in the last 3 months, that you don't need to test negative every week, even if you're unvaccinated. That's an outstanding question, and hopefully there will be some more guidance on that. But in the FAQs are very detailed. If you've seen them, there, the ETS itself is 490 pages, and the FAQs are very detailed, but there is not much in there about COVID recovery other than the payment for recovering from side effects.
Okay, so Greg, this is a little bit on the medical/employer side. Could you talk a little bit about natural immunity, having had it before, antibody tests, and then how long after you test positive during this program do you need to get ultimately vaccinated again? I mean, what are the rules here? Because as you know, there's a lot of people who are refusing to get vaccinated because they're claiming natural immunity.
Yeah, so the standard does not allow for antibody testing, immunity status. It's really looking for, are you vaccinated or not? So that, I think, is really the essence of it here. I think Valerie just articulated what how an employer needs to think about someone who's been positive and what happens before they come back. The goal with the standard, I think everyone would agree, is let's get people vaccinated. Immunity, that's just not really an option here.
Okay.
Natural immunity, excuse me.
Okay, so then 90 days after they come back after testing positive, they would have to go and get vaccinated, basically, or continue to test. Is that correct, Valerie?
Yes, most likely. The issue about whether or not in that 3-month period after they've recovered, they still have to get tested. It wouldn't make logical sense to me, but I haven't seen anything in the FAQs about what happens if you test positive and you're not vaccinated, and then you are still subject to this testing requirement. So we'll see if there's some additional information. And I see someone asked a question about the temporary halt from the Fifth Circuit and whether or not it only affects certain states. No, technically it's a nationwide injunction at the moment. But as I mentioned earlier, I do not believe that these legal challenges are going to be successful. And there's plenty of time before there has to be vaccination or testing for these legal challenges to play themselves out and be dismissed. The federal contractor mandate has been upheld, and that's even stricter. So I don't see that this is going to be successful. So I would not bank on this is not going to happen. I would bank on this is going to happen, and I need to pay attention to it.
Okay, I have one last question here. And by the way, we still have a few minutes. So if people want to ask on the chat or in the question, please go ahead. This last question is back to the bank. As the person who asked the bank question as a sector, as a bank FDIC insured by the government, does that mean a bank is a government contractor?
So the federal contractor mandate, that's actually not an OSHA ETS. It was under an executive order. The guidance in the order talk about what contracts fall under the mandate, but it's not as detailed as you would like it to be. For example, there's no mention in the definition in the exclusion section of banks that serve as a depository of federal funds or paying, or issuing savings bonds. But the broad definitions of the executive order could indicate that banks fall under the mandate, but it's still not 100%. We still don't really know. I would certainly recommend that you consult with counsel as to whether or not your particular business is covered if you have any questions. But there's no definitive answer about whether or not banks that are FDIC insured or that either, any of these services, quote unquote, we just still don't know. So we're still looking.
Okay, that was the last question. I'll wait a few more seconds for any other questions. You have two great experts here on the call, so take advantage of them. In the meantime, do you want to have any closing? Oh, I just got another question. I have another question on the federal contractor. We are a contractor for a company, so we don't hold the federal government contract. Would we have to comply under the federal government contract?
So if you're a government subcontractor, there is potentially a need to comply under the federal contractor mandate. But if the company itself does not hold the contract and you're not actually having any of your employees perform work on a government site, it's unlikely that you would have to comply. But again, we need a lot more detail before I can really say yes or no. I don't want to give anyone information that is incomplete or incorrect.
So basically, this gets quite complicated as you kind of go down the trail of contractor, subcontractor.
Yeah. Yeah.
Well, and on that question too, and Valerie, you let me know if you disagree, but I think it's not, there's a question of, are you subject to it based on, the regulations, but that the entity that's a subcontractor to the federal contractor, that federal contractor may be asking their subs to be in compliance, right? There's a possibility that could be an expectation. So I think that's a little bit more of a circumstantial one that person should investigate.
Okay. Greg, do you want to, any overview, final comments or thoughts for the audience here?
Well, my general observation is I know a lot of companies have been anticipating this and even trying to start their process. And Valerie, you can elaborate to it. I think really, with the regs here, this is the time to put in your best efforts. I know the question came up about the temporary halt from the Fifth Circuit Court, but this is really the time to act. It's a time to really engage with your population. I'm sure timing is not great for many companies with the holidays in front of us here, and that just really is more of an argument to really start to put together your plan and execute on it, and ask your people to work with you and get yourself ready for this compliance requirement.
Yeah, I think a survey is the fastest way to go about it up front, because before you start making decisions about how you need to handle certain things, figuring out what the status is of your workforce, I think is the most efficient way to go about it. So sending out a survey that asks if you are fully vaccinated, partially vaccinated, not vaccinated due to a medical reason, not vaccinated due to a religious reason, or not vaccinated due to another reason will help you determine sort of what your policy needs to or should be. Because if there's 3 or 4 people in your whole company that don't have a vaccine, maybe you just say, okay, I'm not going to bother with reasonable accommodations. I'm not going to bother with, having a mandatory policy and keeping these 3 people out of here. I'm going to just let them get tested. Or you're going to say, no, everyone is is vaccinated to the point that these few people, especially if they're they're not getting a vaccine for a reason that doesn't require reasonable accommodation, if they don't want to get vaccinated, they're out. I'm not dealing with this testing thing. And I've had clients that have, let's say, 400 employees and 20 were not vaccinated at once this survey went out, and they thought it was going to be much higher, but it made it a lot more, easy for them, or a lot more simple to figure out how they were going to go about it. And if at some point you say, okay, well, these people say they have a medical reason, these have a religious reason, engage in the interactive process with them, ask for documentation, ask for support, work with counsel or HR in your business to determine whether or not an accommodation is necessary or required, whether that's remote work, whether that's an unpaid leave if they can't do their job remotely, whether that's testing. That's really a business decision at that point, but it's important to understand what you're dealing with so that you can best prepare to comply.
That's great, Valerie. Just one question on top of that, and I think relevant to this issue of surveys. Are employers, can employees refuse to answer a survey? I mean, is this PHI? What kind of information is this anyway? And what are the obligations of employees? I mean, gosh, we've seen so many of the, groups refuse to comply even with vaccine status on a portal. So
yes,
what is the, what's the rule from here?
So employers, unless you are a healthcare organization and you're dealing with patients, you're not covered as an employer by HIPAA, right? So people say, well, this is a HIPAA violation that you're asking me for my vaccination status. It's not. Categorically, it's not. The EEOC and the on the federal level, which is already more restrictive than many other places, they've already said you can ask people whether or not you are vaccinated. That is not a medical inquiry. If they say no and you ask why, then you're getting into a potential medical inquiry situation if the answer, especially because the answer could be because I have a medical condition. If you're going to then ask, you have additional confidentiality requirements. It's that, and anything you're getting from the employee, whether it's their vaccination card or their test result, that needs to be kept in a separate confidential medical file. But you can ask and you can maintain as long as it's confidential once they provide the information. Religious accommodations are not covered by any sort of confidentiality requirement. So if you want to, I don't know that as a best practice, I'd recommend running around talking about why people aren't getting vaccinated. But if it's religious, you're not under any sort of confidentiality obligation like you would be if it's a medical reason.
But are employees compelled to respond?
Yes.
Can they just say it's none of your business? No.
If they want to say it's none of your business, then we're in that, should this be a voluntary resignation or an involuntary termination situation, right? So if your business is covered and you have to comply, Are you going to let 1 or 10 or 20 employees get in the way of your compliance and subject you to, you know, liability and government investigations because they don't want to tell you? Probably not. And look, if they don't want to tell you, it means they're not vaccinated. that's really the end result here.
Okay. All right. Well, listen, both of you, we've already had comments thanking you both. It's been really helpful, really informative. Valerie's contact info is here on the slide. We will be sending out the PDF. Greg, thanks so much for doing this. And thank you all for joining us, and have a great rest of the day.